Hi, welcome to the Abarca All-In video series. My name is Adriana Ramirez. We're here today with Dan Reedy. Dan is our pricing and underwriting director at Abarca. We brought in Dan to talk a little bit about some of the programs that we've been implementing recently to drive controlling drug costs for our clients. And Dan, just if you can, just share a little bit what you do for Abarca, and then we can kick off the conversation.
I lead underwriting for our prospective clients, and I also lead drug pricing, which involves negotiating rebates for Abarca clients and managing generic drug pricing as well.
I bet that in your current role, you hear from prospective clients, but also current clients, what are we going to do about the volatility in drug spend? Can you speak a little bit about that, and what are you hearing in the market?
The most concerning trend for most of our clients is the increase in specialty drug spending. And there are really two things I think that are most concerning. Number one is that specialty drugs, which represent generally less than 2% of prescriptions, they now make up over 50% of drug spending, and that's going up every year. And that trend is very concerning. The other concerning element for our clients is that there is an increasing number of very specific therapies for a very small number of patients that have extremely high price tags. These therapies can be in excess of $100,000 per prescription. And the problem is health plans or employers never know when they're going to have a patient who's diagnosed with one of these conditions and who needs to go on one of these therapies. And just a few patients on one of these therapies could totally throw off their prescription drug trend.
In the last several months, we've implemented some additional strategies in order to provide options to our clients and prospective clients around how to manage the volatility that we're seeing and give them additional comfort around like what is it that they're considering as part of their drug spend. Can you share an example of something that we've done lately that's along those lines for the folks that are hearing us today?
It's very important for us to be a partner to our clients in helping them solve this conundrum of drug pricing variability and escalating drug spending. And so we've launched a new pricing solution for our clients that really is about Abarca taking more responsibility for the overall prescription drug trend for our clients, and taking some of that variability away from the clients and protecting them from that. And so the way this works is we're providing an overall drug cost guarantee per claim. And so if the drug cost exceeds that guarantee, then Abarca is going to be bearing responsibility for that.
Why would a client choose that?
For clients who are feeling like they're having trouble getting a handle on their drug spending, who are experiencing rapid inflation in their drug spending, or who are experiencing high variability, this new approach may be best for them because it's really protecting them from that variability, and it's forcing Abarca to get more involved in taking responsibility for the drug mix, inflation, and really protecting that client from escalating drug costs.
How do we even make that happen?
This model is great because it really forces Abarca to have more skin in the game, right, and to get more involved in managing drug cost, whether that's improving our cost of goods by negotiating with pharmacies and with pharmaceutical manufacturers, or as you mentioned, getting more involved at the patient level with our clinicians and working with patients to ensure that we're providing value for a health plan's members. The other thing that it really is demanding of us is to take our analytics to the next level and make sure that we're really on top of all prescription drug trends, whether it's new specialty drugs coming to market, new drugs going generic, in every aspect of a health plan's drug trend.
So we've heard a lot of players in the market sharing they're doing the net cost guarantee model. What's different in our model?
Yeah, I think the fundamental difference is that transparency is baked into everything that we do. It's very important for us to have that transparent relationship with our clients so that we can build trust. So the net cost model that Abarca is offering is a fully transparent model where the clients will ultimately see what was actually paid to the pharmacy, they'll ultimately see what was collected in rebates, and they're going to have that transparency around drug pricing.
Well, and it's one of our pillars, a higher standard. Like it's really the core of one of the things that we stand for. So thanks for sharing that. So we've implemented this already with some of our clients. Can you just give us an example of how it's been working?
One of our clients implemented this model at the beginning of the year, and they historically had very variable drug pricing and were experiencing high inflation year over year. And so this model allowed them to lock in a lower rate of inflation than they had experienced historically, and also that fixed inflation percentage for each of the next 3 years that will give them the predictability they were looking for in their drug pricing.
Well, looking forward to seeing the results for the end of the year. Thank you, Dan Reedy, for joining us. Thank you, everybody, for listening in to our All In video series.